Lesson 6 covers contrast media, administration, and reactions. Contrast is used in millions of imaging procedures every year, and contrast-related adverse events are among the most tested topics on the ARRT Registry. We're covering contrast types, reaction classification, risk factors, extravasation administration routes, and risk screening. Let's go. 4 major contrast categories. Iodinated contrast, used for CT, fluoroscopy, and angiography. High osmolality ionic agents are older, with higher reaction rates. Low osmolality non-ionic agents are current standard with significantly lower adverse event rates. These go IV, intravenously, or directly into a cavity. Barium sulfate, oral or rectal use only, never intravenously. Barium is insoluble and causes severe peritonitis if it leaks into the abdominal cavity. Used for gastrointestinal studies, upper GI, barium enema, swallowing studies. Gadolinium, used for MRI contrast, not iodine-based. Risk of nephrogenic systemic fibrosis in patients with severely impaired kidney function. And water-soluble oral agents, used when perforation is suspected or when barium is contraindicated. 3 severity levels. Know them cold. Mild reactions, nausea, vomiting, urticaria, which is hives, flushing, and mild itching. Uncomfortable but not dangerous. Monitor and document. Usually self-limiting. Moderate reactions, diffuse urticaria, bronchospasm, facial edema, and tachycardia. Require active medical treatment. Notify the radiologist and be ready to escalate. Severe reactions, anaphylaxis, laryngeal edema, severe bronchospasm, cardiovascular collapse. This is a life-threatening emergency. Epinephrine, code activation, full emergency response, immediately. The most significant independent risk factor for an adverse contrast reaction is a prior reaction to iodinated contrast. Shellfish allergy is commonly cited, but is not a reliable predictor. Age over 70 and hypertension are general risk factors, not specific. Screen every patient before contrast administration. Ask, any history of prior contrast reaction? Any kidney disease? Current metformin use? Is the patient on metformin? If yes, hold for 48 hours after contrast in patients with renal impairment to prevent lactic acidosis. Lab values, creatinine and GFR, before IV contrast in at-risk patients. A GFR below 30 is a relative contraindication for gadolinium due to nephrogenic systemic fibrosis risk. Premedication with corticosteroids and antihistamines is used for patients with prior moderate or severe reactions. 4 main routes for radiographic contrast. Intravenous, the most common route for CT and MRI. Requires patent IV access, correct flow rate, and real-time monitoring. Oral, used for gastrointestinal studies. Barium or water. Soluble agents taken by mouth. Rectal, barium enema. Patient positioned, contrast introduced via rectal catheter under fluoroscopic guidance. And intra-arterial, used in angiography. Arterial access requires a physician. Your role in these cases is monitoring, documentation, and recognizing complications. Extravasation is the leakage of contrast from the vein into surrounding soft tissue. It happens. Know how to respond. Recognize it. Burning, pain, swelling, or firmness at the IV site, mid-injection. Skin blanching is an early sign. Stop immediately. Do not slow the injection. Stop it. Remove the IV catheter. Elevate the affected extremity above heart level to reduce swelling and promote reabsorption. Apply warm or cold compresses per your facility protocol. Document everything: volume injected, onset of symptoms, time, and actions taken. Notify the supervising radiologist. Arrange follow-up based on the volume and type of contrast involved. A quick breakdown of contrast by exam type to solidify your knowledge. CT of the chest, abdomen, and pelvis. Iodinated IV contrast. Non-ionic low osmolality agents standard today. Upper GI series. Barium sulfate oral. Water-soluble if perforation is suspected. Barium enema. Barium sulfate rectal. Single or double contrast technique. MRI with contrast. Gadolinium IV. Screen for renal function first. Myelography. Water-soluble. Iodinated contrast injected intrathecally. Only water-soluble agents. Barium in the spinal canal is catastrophic. And arthrography. Iodinated contrast injected directly into a joint by the radiologist under fluoroscopic guidance. 3 contrast questions. Exactly how the registry frames them. Think before the answer appears. The answer is B. Moderate reaction requiring treatment and monitoring. Diffuse urticaria bronchospasm and facial edema, 8 minutes after injection, is a moderate contrast reaction. Notify the radiologist immediately and monitor for escalation. The answer is C. Previous reaction to iodinated contrast. A prior contrast reaction is the single most significant independent risk factor. Shellfish allergy is commonly cited, but is not a reliable predictor and is no longer considered a contraindication by the ACR. The answer is C. Stop the injection immediately. When extravasation is suspected mid-injection, stop immediately. Do not slow down. Remove the catheter, elevate the extremity, document, and notify the radiologist. You covered contrast types, reaction classification, risk screening, extravasation recognition and response, and administration routes. Contrast knowledge shows up heavily on the registry and matters every day in practice.